I'm David Kerr, and welcome back to Rappahannock Issues. Taking over from Tom for a moment, and we're talking about the 2016 presidential race. And naturally, one of the big issues right this moment, being profiled tomorrow and being discussed all week, is health. The health of the candidates, specifically brought about by Hillary Clinton's bout with walking pneumonia, and then some of the reluctance on the part of Donald Trump's campaign to release any substantive information about his health. Both candidates are at 69 and 70 respectively, and health is an issue. Do you think this really is this a real issue, or is it a made-up issue? Are we talking about this because we can't find anything else substantive to talk about? Deirdre?
I think this is an issue that's not an issue. What I would like us to be talking about is the nation's health care. I would like the media to be able to turn and pivot and ask, how are Americans' health faring, and how will the policies from these two candidates affect their future and their health care? Unfortunately, we're not able to do that. And so we have pivoted to the question of, is Hillary Clinton sick and dying because she has had pneumonia or has pneumonia? And what is it that Donald Trump isn't telling us by releasing this letter from his doctor? And now through the Dr. Oz show, which has taken us to a level of Dancing with Democracy that I just can't even personally fathom. I mean, I don't understand how we've gotten there and why we're taking this seriously. So on the one hand, I think we're trivializing it as a nation. And on the other, I think it's a deeply serious issue.
I also think that we are really looking at a trivialization in this election cycle. But I do think that the health care of a president is a very key issue that we should all have very much at the public conversation level, because we've had a number of presidents who have been very sick in office, who have had who died in office. We are looking at a situation where we have the oldest set of presidential nominees in American history with these two this cycle, and the level of scrutiny that should be directed towards health makes a lot of sense. I mean, this country has a very difficult environment if the president is not well for any length of time. And so I think it's entirely part of being a candidate for president. If you want to be president, then you have to accept that the terms involve routine release of financial information, routine release of healthcare information. And if you're not ready to do that, then you're not ready to represent this country. It's too high a risk for a president to have a healthcare problem if there isn't full disclosure. And it's also an issue with respect to financial matters. Now, granted, it's not the most important thing that we need to know about a president. We need to know how they're going to deal with Ukraine or healthcare or the inequality that's in this country, issues of race. There are a lot of things that are more important than the individual candidate of the individual candidate's health. But I'm very troubled by candidates who are not forthright about this problem. I think it treats the public with contempt not to be as transparent as previous candidates have been on issues of health and financial status.
The problem for me, though, is we have not had a public conversation about what that means. How much needs to be disclosed? So you have running the first woman candidate ever in the history of the United States. Does she need to disclose her history of pap smears? Does she need to reveal a level of personal health that has never been exposed before? We haven't had a conversation about that. I have no idea what her level of comfort or discomfort is. But there are things I think we don't need to know. And what we have said is kind of this blanket, peel it back, and we don't know what the limits are. And so I agree with you that we need to know what the health status of our candidates are. But you know, the French royalty used to make the Queen give birth in public, right? There's a level about this that makes us feel really uncomfortable as women having to talk about this in the first time ever in the public sphere. So if we want to set some limits for what's okay, if proctology is off the limits and OBGYN is off the limits, I'm okay with that. But I do think we don't have that conversation. Instead, we have a kind of free-for-all vision of what should be disclosed. I don't know how far back it needs to go. I don't know what it is we're looking for. But I think that's part of what we ought to discuss.
Well, I think it's perfectly reasonable to appreciate, particularly with the first female candidate, that we are in uncharted waters in terms of what's being disclosed and what's not. What I am saying at this point, though, is I don't think either candidate has been sufficiently forthright about either financial or healthcare disclosure. I have a lot of doubts about the Clinton Foundation and how that money is being used, but those are nothing compared to the kind of doubts I would have about the issues relating to the finance of the Trump Organization, the various deals with other countries, and some countries run by dictators. These are all major issues. And the best that I want to suggest for a way to deal with these issues is to meet the standard of past election cycles. And so if at a minimum we were getting as much health care information and financial information as candidates gave us 4 years ago and 8 years ago, I think we could start there. And if we need to make an adjustment, well, then we can see where we are. But we're not even to where we used to be. And that's why I really think that this is treating the voters with disrespect.
I don't disagree.
Well, and interestingly, I mean, with McCain, he had to give out a lot of medical information because of skin cancer at his age. H.W. Bush had Graves' disease, so they made him. Reagan with that. So that the health isn't so much. To me, which I thought was an excellent, on their part, pivot by the Clintons, is that they've made this a health issue and not the real issue. I mean, Maureen Dowd said it's not health, it's stealth. It's the idea that when faced with the issue, they didn't come forward with everything, which seems to be reinforces a narrative. Every time that Trump says something outlandish, it reinforces the narrative about Trump. When Clinton was, left the ceremony early, but then nobody knew where she was for 90 minutes. And then it sort of dribbled out over the day. Eventually it becomes known that it's pneumonia. It reinforces the mentality of with the emails and with everything else with Clinton's, that you get that onion effect where it's not as transparent. And I think that is the more troubling thing for the Clinton campaign is it reinforces that narrative. The same way when Trump says something, it's going to reinforce that narrative about Trump.
I really wonder what the campaign professionals are saying. They have to understand that the goal is to avoid the worst possible outcome. And so if a person has pneumonia, you say it, and then you say 9/11 is really important, and we're going anyway.
Yeah.
And then you're insulated against what happened,
Right.
And that's the reality that a campaign professional would offer. I sort of feel like the Clintons are bouncing up against the issue that they constantly have had to deal with. For 30 years, the Clintons have turned first to cover up and paranoia, and now they're trying to make it 31. I mean, it isn't like they've learned the problems of this non-disclosure that have consistently dogged them. It isn't like they've learned from all the negative assessments that voters have offered, both of them with respect to credibility. I think it's a major flaw in
Stephen,
both of these votes.
but Stephen, let me ask you this question. So when they formed the Clinton Foundation, they didn't have to do any disclosure of donors. They set out intentionally are the most disclosed foundation probably in the United States. I mean, part of the question is, when do we know we have enough information? I think that is a fundamental question that we have not really settled on yet. The Clinton campaign, I think, feels like if they tell you she has pneumonia, the next question is going to be what kind? What lung is it? What's your fever? What is she taking for? I mean, it's endless in some ways. Maybe that's wrong, right? But I do think that there is that sense, and that's why they tend to sort of fold their arms around it.
Well, they absolutely have that sense, but they also have the right not to run for president. If you don't want to deal with the public disclosure that's required for being a presidential candidate, then there's another line of work. And somebody as intelligent as Hillary Clinton could find many profitable lines of work other than being president. If she doesn't want to deal with the public requirements of disclosure for health and financial matters, then she should have chosen another line of work.
Well, we have to disclose that we need to take a break right now. So come back and we'll get into a little bit more about the presidential campaign and a little bit into what may happen in Virginia. So come back after this break.